Rheumatic heart disease. It is systemic post-streptococcal non-streptococcal inflammatory disease. It mainly affects heart, joint, CNS, subcutaneous tissue. Etiology. Environmental factor. History of sore throat caused due to beta-hemolytic streptococci. Socio-economic factor like poverty, poor nutrition, etc. It is associated with more spread of streptococcal infection, lack of proper medical attention, and therefore higher indication of rheumatic fever. Inheritance. It is seen in family where the rheumatic fever was seen in the ancestor also. Purvaj. This disease is also reported to occur in the identical twins. Immunological evidence. Parents with rheumatic fever show elevated level of antibody against beta-hemolytic streptococci. Pathogenesis and clinical feature. Rheumatic fever may show cardiac as well as extracardiac lesions. According to the revised Jones classification, following major and minor criteria are included. Major criteria: carditis, polyarthritis, chorea, erythema margitum, subcutaneous nodule. Minor criteria: arthralgia, previous history of rheumatic fever, laboratory finding of elevated ESR and leukocytosis, ECG finding of prolonged PR interval. Suppurative evidence: history of previous streptococcal infection with positive swab culture and raised streptococcal antibody titer. Diagnostic criteria: previous laboratory evidence with any two major or one major and two minor criteria. Carditis, inflammatory involvement of parental pericardium and vessel pericardium. 2. Pancreatitis. Polyarthritis, acute and painful inflammation of the synovial membrane in the rear joint of limb is seen is around 90% of the patient with rheumatic fever. Cholera, it is the general nervous system disorder characterized by jerk movement of trunk and extremities. Erythema marginatum. They are non-pus forming erythematous rash mainly seen on the trunk and extremities. Subcutaneous nodule. They are more overseen in children and accompanied to adults. These nodules are small, 5 to 20 mm, spare and painless. Investigation: leukocytosis, raise ESR, presence of streptococcal antibody, ECG showing prolonged PR interval. Treatment: use of broad spectrum antibody, usually penicillin 10 lakh unit is used to use anti-inflammatory drug from the joint swelling. Tonsillectomy, it is suggested in high risk patient. In case of valvular damage to heart, replacement has to be done. Prophylaxis: in order to avoid further cardiac complication with rheumatic fever is given benzodiazepine penicillin 12 lakh unit every 3 to 4 weeks up to the age of 25 years or up to 5 years after the diagnosis.